My name is Oscar Delgado. I'm the CEO of Community Health Alliance. I've been the CEO since 2019, and it's an honor to welcome you to Reno for an on-site visit. I believe CHA has done some amazing things since our last visit in 2021, and I'm excited to share those with you. But first, I want to share a little bit of background on CHA's history and also CHA service area. CHA was created in 2012 as a result of a merger between Health Access Washoe County, which is HAWC, and also St. Mary's Mission Outreach. At the time, CHA operated 3 health centers that provided primary care and dental services for the uninsured. Community Health Alliance's service area is Washoe County, which is in northern Nevada. Washoe County is home to nearly 500,000 people, which includes the cities of Reno and Sparks. Approximately 14% of the population here in Washoe County is born outside of the United States, and about 25% of Washoe County residents speak another language at home other than English. 90,000 Washoe County residents are on Medicaid. 55% of our patients fall below 100% of the federal poverty level, and nearly 75% of them report belonging to a racial or ethnic minority. We have more than 300 employees here at CHA, which includes 83 licensed providers across all disciplines, 28 of which are bilingual. We serve our patients at 6 fixed health sites across Washoe County. We also have a medical mobile van and a dental van that we take out into the community to provide services. For example, we take our medical mobile van to Our Place, which is our region's emergency shelter for women and children. If you look at any of the needs assessments done in Washoe County over the last several years, you'll see the same 3 issues consistently popping up: access to health services, social determinants of health, and access to mental health and substance use disorder services. Over the last 3 years, CHA has been committed to addressing these needs in our community. Our driving mission is to make sure that everyone in Washoe County has access to health services in a timely manner. While we've seen the number of people with insurance increase substantially over the last 10 years due to the Medicaid expansions, access has not increased. All patients, but especially those on Medicaid, express frustration at how long it takes to be seen by a provider. We're trying to address this issue by expanding our facilities and our workforce. In 2021, we expanded our Sparks Health Center to add additional exam rooms. In 2022, we relocated and expanded our Sun Valley Health Center to allow for 3 more providers and additional service lines. And we have another expansion moving forward at our Neil Road Health Center. We have also been very successful in recruiting new providers. For example, over the last 18 months, we've hired 33 licensed providers across all disciplines. The results of these efforts have significantly decreased how long it takes to see a provider. At the time of our last on-site visit, our third next available appointment averaged 39 days. As of last month, we are down to 13 days, and at some of our health centers, it's around 2 days. The increase in access has allowed us to help more people in our community. At the time of our last on-site visit, our unduplicated patient count was little over 21,000 patients. As of last month, we are now nearly 30,000. We all understand that providing access to health services is only one piece in a healthy community. We also need to address social determinants of health. This is something my team and I are constantly looking towards, and I believe we're making a difference. First, we recently created a new service line of community health workers that assists our patients in addressing social determinants of health. Second, we have some innovative programs, such as our prescription food pantry, that allows our patients to access groceries once a week. These groceries are supportive of any health issues our patients may have, such as diabetes or hypertension. Third, we believe medication adherence is critically important to healthy outcomes, but transportation can often be an obstacle for our patients. So we created a free pharmacy delivery program to deliver medications to patients at home. Fourth, we know that it can be difficult for our patients to take time off work and attend an appointment. So we recently expanded our hours at our largest health center. And finally, one of the largest needs in our community is more access to mental health and substance use disorder services. This is an area that I am particularly passionate about and committed to. Over the last year, we've begun to overhaul our mental health services, and I believe a more integrated model is where we need to go. And we are in the process of making that change. We also recently began offering a medication-assisted treatment program. This is a service line that some of our partners offer, but we realize that we have such a level of trust with our community that we were doing their patients a disservice if we simply referred them out. As you've seen, we have an amazing team and wonderful services for our community. I'm so excited that you're here. Let's get to work.
So at Community Health Alliance, we have 44 medical providers. So we have nurse practitioners, we have physician assistants, we have physicians, we have internists, we have family medicine physicians, we have pediatricians. We also have pediatric trained nurse practitioners and physician assistants. We have a good number of them that are bilingual as well, Spanish and English speaking. So on top of our bilingual providers for English and Spanish, we also have translation services that are available for all of our patients. Most commonly, we use them for Tagalog, for Chinese, but we can see a variety of languages and cultures. On top of that, we have 5 behavioral health therapists that are licensed clinical social workers, as well as marriage and family therapists. So our forte is general primary care, and we see all ages, from newborns all the way to 80 and plus. We try to focus on preventative care and making sure that we're preventing those chronic illnesses that ail people. We have focuses in women's health, we have focus in pediatrics, we have providers who are specifically trained in adult care. So in addition to all the prevention and all the focus that we have on preventing chronic illness, we're very well trained and staffed for a variety of diseases, including diabetes, hypertension, and we also have a multidisciplinary approach that we use to manage all of these issues, bringing in clinical pharmacy, as well as working with some of the subspecialists that we have in our employ. I love the fact that we have integrated care across mental health services, across primary care services. Our goal is just to take care of the community and hopefully make it a one-stop shop for everybody that comes in.
Yo he estado viniendo aquí a Community Health Alliance por un promedio más, probablemente un poquito más de 33 años o por ahí. Cuando llegué a esta clínica fueron primero que nada los servicios prenatales, los programas de WIC, los programas de asistencia para personas con diabetes, todo lo que la comunidad nos ha ofrecido en esta magnífica y estupenda clínica, los alimentos también que nos han estado dando aquí y por supuesto algo que no puede faltar, el servicio médico, que es el motivo principal por el cual yo me encuentro aquí y que no me he movido y que no me voy a mover porque no necesito ir a ningún otro lugar, porque los doctores, el staff y todas las personas que trabajan en estas farmacias y en estas clínicas y que nos dan estos servicios, todas son absolutamente estupendas y realmente no los cambio por nada, ni por nadie, ni voy a ningún otro lugar. A una distancia en la que podemos caminar, allí nos van a estar atendiendo, nos van a estar dando todo lo que necesitamos. Magníficas, estupendas profesionales que están siempre con una sonrisa y dispuestos a ver qué necesita, cómo le puedo ayudar y todo. Eso es magnífico. Entonces todos mis amigos ya están yendo ahí y a los que no están yendo yo realmente los recomiendo porque lo tenemos todo, absolutamente todo. Community Health Alliance ha cambiado mi vida para bien.
I lost my job about 2 years ago, and previous to this, I have a doctor for about 33 years. It was the same doctor. I'm a diabetic, but because I lost my job, I didn't have any insurance, so I have to come out of pocket. So a friend of mine told me about this beautiful place, and I make a phone call, and right away they give me an appointment. And I came over and I see Dr. Dupree for about a year and a half, and she's nothing but awesome. The pharmacy staff, it's amazing. I deal most of the time with Luis and Ida. They ask me if I can go to another location like on Wells Avenue, which is closer to my house. But honestly, I have a connection already with these people, so I don't mind to drive and get my medication here.
We have really comprehensive women and reproductive health services. We're under the Title X grant, which basically allows us to offer comprehensive and confidential family planning services. We are able to offer all birth control options, including long-acting reversible contraceptives, or LARCs. They can come and get IUDs and Nexplanons, sexually transmitted disease testing and treatment, HPV vaccinations, cervical cancer screens through our pap smears. Furthermore, we offer breast exams as well as mammograms. So if the woman is able to reproduce, they go under the reproductive health grant, but if they're unable to reproduce or they are sterile, we are able to offer them mammograms through Women's Health Connection. A Community Health Alliance offers really wonderful, comprehensive pediatric services, and we see kiddos starting at newborns. We do the routine well child checks, where we offer vaccines at all of our clinics. We're also able to take care of prenatal patients, so during their pregnancy and then postpartum. And then we can also take care of their babies, so we do newborn care as well. So we really take care of the whole family.
We have 3 pharmacies on site, one at our Wells facility, one at our Sun Valley facility, and one at our Sparks facility. All 3 of those offer free mobile delivery, generally within the next day, but no later than 48 hours after the date of the appointment. All complimentary to our patients. We fill about 16,000 prescriptions a month, serving up to 2,500 unique patients with those prescriptions. We initiated our mobile delivery program during the pandemic. Our patients were not comfortable coming into the health center, not wanting to leave their house. So we started a free delivery service. We were able to obtain grant funding to purchase our first vehicle, and it covered the cost during the entire pandemic for us to be able to provide that service to our patients at no charge. Our 340B program allows us to offer steep discounts on brand name medications for our patients. So there's no sacrifice where our patients typically would have to get generic medications that are often subpar in their treatment. They're able to get the best medications, especially for diabetes. They get top-tier brand new meds. So we have a clinical pharmacy program. Our pharmacists are able to work in collaboration with our medical providers. Our clinical pharmacists offer assistance in hypertension, hyperlipidemia, diabetes management, and anticoagulation. Our diabetes program is a DEEP program, which is accredited by the Association of Diabetes Care and Education Specialists. We are one of 3 facilities that have that accreditation in the Reno-Sparks area. This year, we also started a MAT program with our clinical pharmacy program. We were the first in Nevada to develop a program using clinical pharmacists. As of January 1st, clinical pharmacists were able to bill for that service as a provider, and we took full advantage of that and are able to offer those services so our patients don't have to wait to get access to that care. During the pandemic, we became one of the top vaccinators for the COVID-19 vaccines, and we were able to work with a lot of different community partners. We are the #1 partner with Washoe County School District. We partner with Northern Nevada Public Health. They're also a huge component with the Vaccines for Children program, and we do a great referral system back and forth.
CHA Dental serves children and adults in the greater Reno area. We have 2 brick-and-mortar locations, one at our Wells location, which has 17 operatories, and one at our Sparks location that has 3 operatories. We also have a mobile dental van with 3 operatories that goes out amongst the community. Additionally, we have dental hygienists with a public health endorsement in the state of Nevada. They go out and do fluoride varnish and screenings to school-aged children, mostly at Head Start locations, but at health fairs and other events throughout the year, and they're allowed to work unsupervised due to their special health endorsement. We have 5 full-time dentists, 5 full-time hygienists, 1 per diem hygienist, and 1 per diem dentist working with CHA. Additionally, we have 11 dental assistants and 1 sterilization tech. Last year, we served 4,024 patients. In the past year, we've had 12,095 dental visits. We're able to work in an integrated care model. That's not something most dentists have available to them, but it's a huge benefit not only to our mode of practice, but also to our patients. It means we can work closely with the medical professionals and behavioral health professionals we have on staff. Currently, we have a dental hygienist embedded in our PEDS medical practice. The hygienist there goes in during well-child checks and does screenings, fluoride varnish applications, oral hygiene instruction, and nutritional counseling. The ADA recommends that children be seen at 6 months or when their first tooth erupts. So by having the hygienist in our pediatric practice, we're able to get access to those kids right away so their parents can start addressing their dental health early. And prevention is really key. A main focus of ours is to really get more integrated with medical, dental, behavioral health, and pharmacy. We are hoping to integrate with our OBGYN practice so that we can make sure that every pregnant woman we see has a dental screening and then is able to come into the practice and get all their dental work completed prior to delivering the baby. We also are hoping to integrate with our MAT program so that dental can be a part of recovery for patients. Everyone that works here is just amazing. They really have a calling to help other people out, and that makes a big difference in your day-to-day life.